Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Bull's eye maculopathy. Right. In the bull's eye maculopathy, there is hyperpigmentation occurs in the fovea called as central foveolar hyperpigmentation is surrounded by depigmented zone which is again encircled by a hyperpigmentation ring. So if you draw this, actually central foveolar hyperpigmentation is present, surrounded by depigmented zone and again hyperpigmented ring. So this is something like this. So this is bullseye maculopathy, where foveolar hyperpigmentation surrounded by depigmented zone, which is again surrounded by hyperpigmented ring. So what are the causes of bullseye maculopathy? Bullseye maculopathy is seen in three main conditions, that is chloroquine toxicity, it can be seen in cone dystrophy, and it is also seen in Batten's disease or Batten-Mayo syndrome. Batten's disease or Batten-Mayo syndrome is a cerebromacular degeneration.
thank you and thank you for watching.